have. Just because it's common doesn't mean it's not bad. It is bad.
So when it comes to pre-diabetes, you can reverse that, but not many people are willing to put the work and effort in for it. I mean, some truly are, or even if they're in that diabetes range and we start a medication, some people do put the work in. They're like, yeah, I'm changing my eating habits. I'm changing how much I exercise and move my body. And you know what? They bring their sugar levels down.
It's Doctora Victoria and George.
I am both a family medicine and an obesity medicine specialist, and I'm boarded in both. And I saw the interview from Tucker Carlson talk to some guy about Ozempic, and that's a medication I use regularly in obesity medicine and to treat diabetes. And I had to stop watching because I'm like, man, this guy does not know what he's talking about. I'm all for a good conspiracy theory, but this guy was not having it. So let's take a look and see what exactly he had to say, and if I can't give you a little insight instead. All right, so let's go ahead and start from the beginning. I may need to put it on fast forward. I don't know if I can tolerate him talking so slow too much. But let's see.
You'd think less than 2 years after the very public failure of the COVID vaccines that more people in this country would be skeptical of brand new pharma products. And maybe they are, but they don't seem very skeptical of Ozempic.
I do appreciate that.
At least in the short term,
everyone's like, no, I don't want the vaccine.
That's a huge problem. And a lot of people, us,
they're coming out with fresh ones just like the flu every year.
So why
but for weight loss, I'll try that.
You were not hearing on the question of Ozempic from someone who knows a lot about it. Callie Means is the founder of TrueMed. He once worked for Pharma. He definitely does not now. And he joins us today in studio.
So TrueMed, I had to look him up because I'm like, who is this guy? Because he doesn't know what he's talking about, which we'll get into. At least not on a lot of things from the science standpoint. But he's some business guy, but his sister is a doctor. You did not go to medical school by proxy. Can I just say that? No. My brothers and sisters, they did not go to medical school just because I did. Okay. And he sells supplements. I'm sorry. But I do appreciate, we'll see, he likes to talk about exercise and what we're eating. And I appreciate that. That's important.
Pump the beer, Tucker.
So you want to lose 20, and I'm speaking from experience, you want to lose 20 pounds, you don't really want to stop eating pizza. This seems like a super quick way to get healthier. Why wouldn't you take Ozempic? Why shouldn't I take Ozempic?
First off, to stop eating pizza, dude, you got to stop the pizza. Once in a while is okay, but these medicines are to help. Okay, I'll keep going. Let's let them start.
3 big reasons Ozempic is very problematic, and I think really the Rosetta Stone to understanding what's gone wrong in healthcare and frankly pharma industry corruption. The first point I want to make is that if a fish tank is dirty, you clean the tank. You don't drug the fish. And in America right now...
So they won't notice.
In America right now, we've got a very dirty tank. 50% of teens and 80% of adults are overweight. And this has happened in just a generation. We didn't become systematically lazier in the past generation as Americans and frankly suicidal. Something has happened. And the core mistake of Ozempic is that obesity is not an Ozempic deficiency. Obesity is not the root cause of the problem. Obesity is one branch of the tree of underlying metabolic dysfunction.
So I do think that exercise, eating well is important. I think the food here... I live in the United States. I'm not American, but I came, and the food is different here. It's weird. I'm Canadian, and our food back home, it just is different. And I think overall, too, in North America, we eat in a similar way, but the food here definitely is different. That's unusual. I do want to say, I like what he said. Hey, obesity is not a lack of Ozempic. All these medicines that we use for weight loss, it is not... that they do the weight loss. There are tools to help you do the weight loss and do the kinds of things that will help you lose weight. That exercise, our goal is 150 minutes a week of huffing and puffing for heart health and to be making wise choices in the kitchen.
Ravaging our country. As we talked about, with over 50% of Americans having prediabetes now, 33% of young adults.
Most Americans have prediabetes?
Oh, it's by some measures it's up to 60%.
Of the whole country?
Of adults and 33% of young
so
adults
yes,
and teens.
Lots of prediabetes, lots of diabetes. Obesity is definitely on the rise, and it's projected to just increase.
And you have a diabetes doctor, just a generation ago wouldn't see one child in their entire careers with diabetes. Now, diabetes, which again is cellular dysfunction, is cellular disruption, totally caused by environmental factors and what we're eating. That's close to becoming, right, upwards of 50% of kids. It's 33% and growing radically. Teens, 25% have fatty liver disease, which is something you only used to see in elderly alcoholics. So there's a metabolic health crisis that's caused by decisions.
I appreciate that, and I think that is true. How we're moving our bodies, how we're feeding ourselves, all of that comes into play, and I think that is accurate.
Which is completely corrupt, the guidelines that set nutrition standards, 95% of the guideline committees paid for by food companies, they say that a 2-year-old, that 10% of their diet can be added sugar. We have more money.
That is a little bit scary. I don't like that we've got all kinds of companies saying what our food guide should look like. And no child should be eating that much. They should not have sugar, if at all possible, like ever. If you just feed your children fruits and vegetables and whole grains and lean cuts of meat, that would be ideal. We don't live in a vacuum. I don't know how you can protect your children from that or what they're going to see at school or what their friends are going to eat, but that would be nice, because if they're eating a black load of sugar, that's just not good for them.
Subsidies in America today go to cigarettes, go to tobacco, then vegetables. 90% of subsidies go to highly processed food. We prop this industry up. Food stamps, right, which 15% of Americans depend on for nutrition. 10% of all food stamps funding goes to soda. We're the only
That is a little bit crazy. I don't like that. Food stamps can be used to buy unhealthy things. I feel like there should be more guidelines on that. That is a little bit insane.
That allows that. So we hear
Goes to soda?
Goes to soda. So
the U.S. government pays people to drink soda?
The U.S. government, direct from the federal treasury, more than $10 billion per year go from the federal treasury to soda companies through the food stamp.
And when it comes to soda pop, so if you have the sugar-free version of soda pop versus the regular sugar version, now if you have diabetes, it will make a difference, because if you don't actually have sugar in there, you're not going to raise sugar values. And so in that sense, if you need something sweet, and there are many other alternatives, and you don't necessarily need to drink anything sweet to begin with, but if you had to make a choice, then yes, the sugar-free version is in theory better for diabetes. But when it comes to weight loss in general, because the brain perceives sweet on the tongue like it is sugar, people have the same amount of weight gain with the sugar-free option as they do the regular sugar option.
Number one item purchased with food stamps in America is addictive diabetes water. We prop that up with food stamps. As we talked about last time, I actually used to work and consult with Coke, and we paid the NAACP and other groups to say it was racist to take that away. We totally rigged the debate. So through a corrupt system, we actually subsidize soda. We do 10 of these things, right? We do 10 easily identifiable things that are causing us, frankly, to be poisoned. And instead of talking about the root cause, we're saying that a weekly injection that you have to take for your entire
Well, yes,
life.
if someone is coming in, then I sure hope that they're talking about the root cause. And anyone who's coming in for a diabetes consult, they're going to be receiving counseling on exercise and diet. And something else is sleep. If I have a large BMI for my patient and weight loss is a subject of conversation, I always will address sleep. And something I screen for every day is sleep apnea. And the test now, you don't have to go, well, I mean, depends on where you live, I suppose. But for most of my patients, I'll do a home sleep study set. And with that, it's, well, I have a little video, I'll link that, but it's a watch you wear, thing on your finger, a little sticker on your chest, and we see if your brain is waking up. People often have no symptoms, and except perhaps some fatigue during the day. Maybe they could take an afternoon nap. They tell me, oh no, when I sleep just fine. Well, I'm sure you do. But often my patients will have sleep apnea, and it is very hard to lose weight until you treat that sleep apnea. It's like an uphill battle to try and lose weight if we have untreated sleep apnea, because you cannot recuperate and recover. Something else he said is something for the rest of your life. And we consider weight management to be a long-term course of action. So if your body has something we call a weight set point, and so our weight wants to be in a certain spot. You can eat too much, you can eat too little, your body wants to keep that weight. If you keep feeding it too much, eventually we can raise that line and your weight set point will go up. However, if you exercise, we can bring that weight set point down. But what happens if you stop? The weight will come back. What happens if you change your eating habits? You can bring that weight down. But if you stop and go back to your old ways, the weight will come back. And because that body wants that weight set point. And it is the same thing with a medicine intervention. We can bring weight down with medication. And if we stop, we expect the weight to come back. We may not need the combination of medications or the amount of medicine that we use to get the weight off, but long term, people most likely need something so that we can convince the body that the weight set point, instead of being higher, is in fact lower. I have 2 caveats for that. If you are under 30, you may not need weight loss treatment from a pharmaceutical medicine standpoint for the rest of your life. My other caveat is the year following pregnancy. So if you're under 30, we still consider there to be enough hormonal changes going on that we can reset your weight set point. And in the year following pregnancy, there are enough hormonal changes that we can reset the weight set point. And so for my women over 30, if they're going to have children, we still expect that we may be able to change that weight set point. And again, if you are under 30, we expect that we are going to be able to change that weight set point. Not in every case, but those are my 2 caveats. But I do consider weight management to be long-term.
That costs $20,000 per patient when 80% of American adults are overweight or obese. We're saying that is the answer for obesity. We have a dirty tank, and pharma has basically changed our consensus reality to say, when all these things are happening all at once due to environmental factors, our savior, you do the math on $20,000 per patient, 80% of American adults, we're talking, and this is clear on Wall Street, food stocks are going down, pharma stocks are going up because they're doing cartwheels on Wall Street. This is on track because of government funding, because we stand to put trillions of government funding into this drug to be the most successful drug in American history.
I don't disagree. I do think that it is a medication that's certainly very popular, and because obesity levels are just expected to rise, I don't see any big changes when it comes to our food industry and the processing that goes on with food. There's not as many changes going on, so no, I don't expect that to change, and in fact I do expect it to get worse.
Wow. There's a lot there. But let me just get back to the individual decision to take or not to take this drug. So you're overweight, you have pre-diabetes, and your doctor says, what you would say, which is that's a very serious thing to have. Just because it's common doesn't mean it's not bad, it is bad.
So when it comes to pre-diabetes, you can reverse that, but not many people are willing to put the work and effort in for it. I mean, some truly are, or even if they're in that diabetes range and we start a medication, some people do put the work in. They're like, yeah, I'm changing my eating habits. I'm changing how much I exercise and move my body. And you know what? They bring their sugar levels down. And I'm like, this is fabulous. Let's do a trial off the medication. They've brought down their A1C. A1C is their average sugar levels over the past 3 months. I can say that because what we measure in an A1C is your red blood cells and how much sugar gets stuck onto those red blood cells. Red blood cells last for about 3 months. So we can see your average sugar levels over the past 3 months, as long as you don't have anemia, because then your red blood cells would be lasting for longer and you would have an abnormally high level A1C, because there would be extra sugar stuck on because they would last longer. But for the most part, the A1C will tell us over the past 3 months how bad is your sugar levels. And we'll see, oh, hey, you know what? We've really got it down. Yes, let's try coming off the medication. We'll ease our way off. We're just still doing good. Oh, yeah. If we can stay off medication, I am all for it. But particularly in my region, I have very few patients who are willing to put the effort in. And if it means that we're able to keep you off of blood pressure medication and cholesterol medication, and instead of going up, and having to treat more and more, we're able to use less medicine. I mean, if I could do a medicine once a week versus do a whack load of medicines for lots of things in the long term and be at risk of lots of hospitalizations, I would say that is a good fit for most people. And after you reach a certain BMI, usually around 35 to 40, we see that when it comes to your fat cells, you're able to get more fat cells. And say this is my normal fat cell size, but say I have a bunch of fat cells. So there's more than what should normally be there. And to be a normal body weight, we have to take our normal fat cell and make it really small, really tiny. The fat cells do not like that. They do not like that at all. And people think that, oh, they're just for storage. Oh my gosh, our adipocytes, our fat cells, They are the chatterboxes of the body. They are talking all the time. They are sending signals all the time. They play a huge role in the body. They are not just for fat storage. And so, that being said, it's very, very difficult after you reach a BMI of a certain, that 35, usually it's about 35, that is very, very challenging to get the weight down. Yeah.
Can cure it. Why wouldn't you do that?
That segues really well into the second issue why Ozempic is so problematic. So on a societal level, I think anyone that agrees, if you're just looking at this issue, pumping everyone Ozempic for their lives isn't the first thing you do to solve obesity. But even if it was perfect,
that would be really nice if I could get all of my patients to exercise. But also, when you have a BMI that is so high and you need some knee replacements, the surgeons don't want to do the knee replacements because you're at such high risk because of your weight to, like, on the operating table, like, you're at such high risk of complications from the surgery. So we got all kinds of joint pain. It's hard. Not that I'm making excuses. Oh my goodness. You can sit there and you can pretend that you are boxing while you are watching TV. You can get those little pedal things to put in front of your chair. There's all kinds of things you can do to move your body, even if something hurts. That being said, it is more challenging with more weight to do exercise, especially once we start hitting our morbid obesity. So this is that BMI of 35 with a comorbidity, perhaps diabetes, obstructive sleep apnea, something like that, or your BMI is 40. And our normal BMI is up to 25 for reference.
Perfect. But the problem is when you get to the individual level, this drug medically is a absolute disaster.
I do not, well, let's see what he has to say. But I am skeptical, yes.
It's a disaster. So all you need to know is that Novo Nordisk, the company that makes this drug, recently passed LVMH to become the most valuable company in Europe. So this company, most valuable company in Europe, they don't allow this drug for obesity in Europe.
So first off, this group of medications, Ozempic is a glucagon-like peptide 1 medication, GLP-1, you might hear that. We've had many of these medications on the market for a very long time, but we hardly use them. We really glossed over them. So when I was going through medical school, they were kind of a blip on the radar. We didn't talk about them much because they didn't do a great job. These newer ones, and particularly the injection version. So Ozempic actually, so the medicine itself is called semaglutide, and it has 3 forms. And one is a pill form called Rybelsus. There is the diabetes version called Ozempic, and there's a weight loss version called Wegovy. And the pill form is a little bit different. We don't see as much weight loss with it. Sometimes people still notice some decreased appetite. I suppose I should explain the GLP-1 itself. So your gut makes a hormone and it tells your brain, hey, I'm full, I'm satisfied. It tells your fat cells, hey, you need to burn off some energy. It tells the pancreas, hey, squirt out some insulin. And it tells your heart some good things. And it does this on a regular basis. But what you make, your body makes, it lasts for a few seconds. It will send that signal every now and then, but it is not constant. These medications provide that constant signal. So your brain is constantly getting that signal, hey, I'm full, I'm satisfied. Hey, squirt out that insulin. Hey, fat cells, you need to be burning off some energy, and the whole shebang. Rybelsus is a once-a-day medication, and then the Ozempic and Wegovy are once-a-week medications. The Ozempic and Wegovy are pretty much identical except for their administration pen, except the Wegovy, the weight loss version, that medication actually goes to a higher dosage amount than just the diabetes amount. That's kind of how they work in my tangent. And Ozempic is not the only kind. Eli Lilly has the Mounjaro and Zepbound. So there's other companies with, well, technically that one is a little bit different. I think it's Eli Lilly that also has the Trulicity. It's a once a day, or it's also a once a week injectable GLP-1, but we don't see the weight loss that we do in the tirzepatide, which is the Mounjaro, or the semaglutide, that is the Ozempic. And then there's also a once a day medication, but I don't know the company. That one is Victoza and Saxenda. Victoza for diabetes and Saxenda for weight loss. So just because you don't like a company's practices doesn't mean that the medication itself is not good.
all of Novo Nordisk's revenue is coming from taking advantage of Americans. This is not the first line of defense for obesity in any European country. It's not approved by the government regulators. They are saying on their stock calls that all of their growth is coming from the U.S. They're taking advantage of a broken
The U.S.
system in
also
the
has
United
a
States.
lot of obesity and a lot of diabetes, just in general. I don't know. I feel like I got a buddy who's German, and I'll see, maybe I can find out what he's got to say about the diabetes over in Europe. So,
dive into it. Even people in the United States who are getting government funding, insurance funding for this drug don't have to pay for it. 30% of them go off the drug within 3 months. So even though they're fully being paid for it, we're being told this is a lifetime drug, there's lawsuits coming, just reported in the past couple of days, on gastrointestinal issues and stomach
it's something called gastroparesis, and it is slowing of the intestinal tract. And so bowel movements don't come quite as regularly. Now with these medications, I expect that people will get some nausea if they eat the things they're not supposed to. The medicine works best when it works the most when there's a high sugar level. So if you have the white bread, the white rice, the pasta noodles, the chips, the soda pop, the juice, the cookies, the cake, the medicine has to work harder. You should expect nausea to come. It is not normal for you to have nausea all the time. If that's the case, then that would be an indication to switch and try a different medication even within that class, either a GLP-1 or a GLP-1/GIP.
Itself essentially is stomach paralysis.
What is stomach paralysis?
The drug, what it does is essentially it sterilizes its stomach.
Okay, I don't think he really knows what he's talking about. But what we do see is gastroparesis and the slowing of food as it moves through the gastrointestinal tract.
To make you not be able to process food correctly. And there's studies now saying that stomach paralysis, the really messing with your ability to digest food, actually stays after you go off the drug. So there's lawsuits now with people with severe gastrointestinal issues after coming off the drugs. That's being pronounced, and that's coming out in lawsuits. Additionally, because of that,
something else in terms of our contraindications for the medication, I would say that is not the most severe thing that can happen on the medication. We check if someone has always ask, do you personally or in your family have any history of these problems? And if you've not heard of them, you do not have them. Multiple endocrine neoplasia type 2, medullary thyroid carcinoma, and pancreatitis that has not been caused by gallstones. And then because I also do obesity medicine, I check for glaucoma because I also prescribe topiramate off-label for weight loss. And that's the medicine we use for prevention of migraines and seizures. But I would say probably the pancreatitis would be the worst case scenario of something to happen. And so the pancreas is a little organ that sits just behind the stomach, and inflammation of that is very dangerous, very bad. And so we want to screen if someone's ever had a history of that. If that is the case, they are not a good candidate for these medications.
Drugs.
Yes.
So that's almost, I think, universally accepted even by Novo Nordisk. When you go off the
I think
drug,
I told you that earlier. Any intervention. You exercise, you bring the weight down. If you stop, the weight comes back. If I change my eating habits, I bring the weight down. If I stop, you gain the weight back. If I do a medication to bring the weight down, I can bring it down. But if you stop, the weight will come back, with my 2 caveats: if you are under 30 and that year following pregnancy.
Again, we're seeing most people that take the drug within the first year come off it because the gastrointestinal issues, the stomach issues.
I wonder where he's saying that. Well, perhaps he's got some nice data for that. But I know for my patients, they are very keen to stay on it. And in my region, we have a big organization and they stop covering weight loss medications. And so people, sometimes they're paying out of pocket. Sometimes we're trying some alternatives. But they're itching to go back on these medications because they are so effective and needed for maintenance.
Again, where this company is based, just launched a probe into suicidal ideation caused by Ozempic. You can't even make this up. But the EU is doing a massive probe because there's so many reports of increased depression, increased suicide.
Now, lots of rates of that, okay? I would also say, just in general, there's a lot of depression and anxiety going around. And probably, I didn't pull the data from my patient panel, but I would say most of them have obesity on their problem list, and they've got depression or anxiety on their problem list. So just because there's an association does not necessarily mean that there is causation. I don't know if we can say that. Is that fear-mongering? Maybe, maybe not. But we don't know.
was debating a Harvard doctor about 6 months ago, and I brought this up because it's kind of obvious. Your serotonin, what produces your contentment and happiness, 95% is made in the gut.
Yes, there's a ton of hormones going on in the gut. And so they do have a big role. I would say maybe more importantly is the bacteria flora in your gut that makes a difference.
Gut dysfunction.
Okay,
so
well, we're slowing it down.
Mess with the gut, a lot of unexpected things happening, and very understandable.
But I would say no,
really
it's the
what's to be
bacteria that
expected,
we're
because
growing in our
actually
gut a
seeing
little bit more.
of a mass increase in mental health disorders and even suicidal ideation from Ozempic. Kind of you just back up and ask,
Eating
this medical drug
disorders.
is too good to be true.
Well,
It's
first
really
off, you should be screened if you have an eating disorder beforehand. But also, there's decreased appetite, so you're not going to be eating as much, just in general.
Wait, so you're saying there could be a downside? It's not perfect?
30% of people. But I want to say this, and I'm a libertarian. I think people should be able to take Ozempic. I think most drugs should be legal, frankly. The problem is where the rubber really hits the road is there is an all-out assault to convince us that this is the appropriate drug. Again, this is the target market. This is why the stocks are popping and why Wall Street's going crazy. It's the biggest TAM, the biggest target market for any drug in American history. It's 80% of American adults. But it's being fast-tracked. You wouldn't believe this, but the American Academy of Pediatrics recently said that they recommend this as a first line of defense for teens. And study basing that decision.
So when it comes to kids, we want to try and get their weight down. If we've got just a little bit overweight, we're not even in the obese side, our goal is, can we increase in our height but keep our weight the same? We want to increase our activity levels. We want to be encouraging the family. Can we be having family meals together? If you've got a good dietitian involved, like there's some different styles of doing dietitian work, but they'll ask the parents, hey, take a video of when you do your family meal together, and they'll be able to pick up on all kinds of habits, and then they'll go through, hey, what are we eating? So that's always nice to get that medical professional on board. But if we can get the weight under control, we want to, because it saves these kids lots of issues in the long term when it comes to self-esteem, when it comes to health problems. I would say, yeah, we want to get childhood obesity under control. And Ozempic, we are indicated in that pediatric population of teens.
The American Academy of Pediatrics to say that every obese or overweight teen, which is 50%, should take this drug, was a 68-week study. We had a 68-week study for a lifetime recommendation to 50% of teens in America to receive these injections.
But also, remember, that under 30 age group, which these teens would fall into, we don't consider this to be a long-term medication.
Me coming from the American Academy of Pediatrics, which seems really like a vector for badness, given their performance during COVID. However, you just still have to wonder, how did that happen? That seems reckless. Like, how could a body like that, which has some residual moral authorities because of its name, how could they do that?
You are transitioning perfectly into the third point, which is that the reason Ozempic, I think, is such an important story in America today is because it's really, again, it's the Rosetta Stone of understanding corruption. Our institutions, particularly healthcare.
That's a little fear-mongering. I don't know what that is. But, I think he's fear-mongering. I feel like that's sad. It's really good for diabetes. I would say it's probably the best medication. I mean, I actually like Mounjaro a little bit better. For my patients, they tend to tolerate a little bit better. I'm able to get to higher doses on it than I can compared to the semaglutide with Ozempic or Wegovy. So I actually like that one a little bit better. Also, when it comes to supply, right now we can get the tirzepatide a whole lot easier than we can semaglutide for the most part. However, I did hear from the Ozempic drug rep that we're not having issues with supply in the United States as of right now, and all doses are available. And it is the beginning of March 2024. So that is good news. The Wegovy, still not so much though. That's not much of that.
Has completely let us down. And you just step back and think about it. Pharma is the largest spender on TV news ads. It's the largest spender, Novo Nordisk specifically is the largest spender on foundational obesity research. It's the largest spender on medical groups like the AAP. It's one of the largest funders of actual civil rights groups. So you actually can't even believe this, but Novo Nordisk is paying the NAACP to say that not supporting Ozempic is a civil rights issue.
So you're racist if you're against giving kids a diabetes drug?
Now that's politics.
Website and
I don't know about that so much. I'm not in politics.
Ozempic,
I'm not American. I just have to order my Canadian
with obesity in certain communities.
Vote from abroad for next year.
Government funding for Ozempic, of course.
And the NAACP takes money from the drug maker?
They're a registered lobbyist for the drug maker.
How can the NAACP be a registered lobbyist for anybody?
They have a lobbying organization. They have to declare who their lobbying clients are. And as reported in NPR very recently, they are registered as a lobbyist for Novo Nordisk. And on their website, they're saying it is example of systemic racism
by the way.
to not support federal funding for Ozempic. So this is what I saw working for pharma. You just have to ask who people trust. People trust the medical groups, they trust civil rights groups, they trust the media. You have a situation where, additionally, Novo Nordisk, and this is reported, has given $30 million in direct bribes to obesity doctors. You would be
I don't know anyone who's getting bribes. I mean, they grill that into you pretty good in medical school. You can't take any gifts. You can't take gifts from patients. That being said, I did get some freeze-dried Skittles from one of my patients this week. I did not share it with the staff like I was supposed to, but they are way better than Skittles. But you're not supposed to take presents if it's small or a token. You can maybe do that, so I don't feel too bad about my Skittles. But as we talk about obesity medicine, but they were good. And let's see. So I don't know who's getting bribes. That seems sad. When we have drug reps come, we do let, in my clinic, as a group, we do let the drug reps come into our office. They have to provide lunch for the whole staff to get a minute with us, and they give us updates. Sometimes they're bringing samples. I think it's super helpful. I love having samples available in the office to share with patients. It doesn't matter if it's a headache medication, Ozempic, or let's see, some Xarelto, whatever it might be. So it's really handy, especially when patients are maybe having a hard time financially, or it's expensive for them to be getting medication, or they have a big copay. If we're able to help or get some inhalers, then we want to be able to do that for them. And I appreciate that. They're not bringing me any presents, though. They give me booklets. Sometimes there's pens, and I snitch pens because I lose pens. I've never gotten a bribe, though. I'm not sure how to get a bribe. Not that I want any. Yeah, that seems sad. I just feel sad that doctors take bribes.
Obesity in this country who has not received some kind of donation, not research grants, but direct consulting grants.
Now, that being said, consulting stuff, sometimes, so there's like the pharmaceutical companies or whatever, they've got a medication they want to talk about, and they'll put on a dinner. And they'll have someone who is a specialist in their field. So I went to one recently because it's helpful to be up to date on the various literature or whatever. So there was an endocrinologist who specialized in obesity medicine, and so he was also boarded in obesity medicine. So lots of folks can get in my group with the hospital system I work with. We have internal medicine doctors, we've got family doctors, and we've got endocrinologists, and so we're boarded in those things, but we also are boarded in obesity medicine, and that helps us take care of our patients a little bit better and in a special way, so we're able to offer that service for our community. And the speaker they had come in was an endocrinologist, and he was very well known in his field. And I do believe, they must have paid him because he came from out of town. And so the Zep-bound folks had him come in, and he gave us this talk over dinner, and we got to learn a little bit more about the pathophysiology. We got to ask questions. In medicine, we always have to keep learning, and so I thought that was really nice. Maybe that's what he's talking about, but I'm not sure.
Exactly. So
how can doctors take cash from drug makers?
Oh, this is what's done. The drug makers spend hundreds of millions of dollars a year in direct cash payments to doctors.
But you can't get the drug except with a script written by the doctor.
Yeah, who take direct consulting fees.
Not everybody's doing that. I told you about the speaker kind of stuff, and I'm going to assume that particular endocrinologist. I've done it before for like pulmonologist, and like there was a pulmonologist who came up from the big city and gave us a talk. So that's really nice. And it's really nice to be able to talk to physicians from other areas and be able to ask questions. And when they give the speak, they're not scripted, but they do have some specific guidelines. They can't really talk about off-label indications or anything. But if you get them kind of around the corner a little bit, then you can kind of ask them whatever you want in terms of pathophysiology or the way things are used. And that's actually really helpful.
This is what you watch things about the opioid crisis and how the opioid.
My husband did have me watch some show. I think it was on Netflix about the opioid business and all the corruption. If I can remember the name, I'll link it below for you. I really enjoyed it, but I was also very saddened. They were just after some money, and they caused a lot of issues. But I've got a patient, and he struggled. He had like knee replacement and shoulder replacement and all these surgeries, and was on opioids. And we had to work on some, like, getting off the opioids real rough because he was getting them from all of his different surgeons and had a few different surgeries kind of back to back and was in a lot of pain, and he was on opioids for too long and was not well coached on, hey, we need to taper down, we need to taper down. I do not like controlled substances for the most part. That being said, a medicine that I do use a lot in obesity medicine is control, and that is phentermine or Adipex. It used to be called Fedfen. It has a very low rate of abuse potential, though. Very, very low. So, anyway.
I was working for pharma. The opioid crisis was in full effect. And there was a panel in 2012. And the panel was full of outside experts recommending guidance on opioids. The head of that panel was a man named Dr. Philip Pizzo, who was the dean of Stanford Med School at the time. He was a pain specialist. At the moment he was appointed to that panel, Stanford received a grant from Pfizer, who's one of the largest opioid makers, of $3 million for pain
What does
research.
Pfizer not
He appointed 90%.
I'm just saying. They make a lot of stuff.
That panel, who are also conflicted, to receive direct research and personal consulting fees from opioid makers, and they released relaxed opioid standards. This is exactly what's happening on obesity. You have Dr. Fatima Stanford, the head of obesity research at Harvard, paid tens of thousands of dollars by Novo Nordisk, just started a new... Directly? Direct. No, not to mention, of course, millions of dollars of research grants. She's been paid tens of thousands of
But
dollars.
how can Harvard allow that?
There are no conflict of interest rules in medicine. Harvard is supporting her, and the NIH...
I don't know what this lady is doing.
8,000 research grants went to university professors who also have a direct conflict.
But it does sound like there's
with the
corruption.
Topic in the drug
I think
study.
any
How can you
field
be a
will probably
physician,
have some kind
even a
of
teaching physician, and do that? I mean, that's so obviously
corruption
It's
somewhere.
so obvious. It's so omnipresent.
Is this bad? But she's from some kind of bougie school. All of those big schools and the Harvard, they always got some kind of scandal going on. I'm not surprised. Is that bad? Yeah.
It isn't discussed. I mean, you're saying this like it is obvious. It's manifestly obvious. You hear this, most Americans are outraged. This is like, you're swimming in water, you don't realize you're in water. This is how academia is. The food industry, if you taking it to food, which is making it sick, spends 11 times more on foundational
now
nutrition
the
research.
food. Oh yes, dumpling. Oh honey. So that the processed food and everything is going on, and that they're spending tons of money, I'm not surprised. And I feel like that's really sad. And that's where we should be pushing back. Yes, honey. That's where we should be pushing back.
Than the NIH. Pharma is the lifeblood, right, of foundational scientific research in this country. And then you get to the NIH, of course, it's a revolving door between government and industry. And the vast majority of NIH grants go to pharma research. So the NIH is basically a grant-making organization. And this is just statistical, almost all going to research that has conflicts of interest with pharmaceutical drugs. The problem here is that every institution, all these institutions fundamentally make more money when we're sick. Ozempic doesn't cure obesity. It manages obesity for life. And that's a problem.
Sorry, I missed it. I was distracted by the cat. Okay.
Every institution, all these institutions fundamentally make more money when we're sick. Ozempic doesn't cure obesity.
Well, it gives you the
manages obesity for life.
tools to help you with the weight loss and helps you to keep it off long term. It is just a tool. That's all it was ever meant to do. It's not meant to actually cause the weight loss. The patient with hard work is meant to cause the weight loss. I have a lot of patients that I have to emphasize that too. That the medication is not what does the weight loss. It helps you do it, but it is not the reason for it. I know I'm too loud, aren't I? Nutmeg. I'm getting a little bit salty.
And that's a problem. Statins don't.
I'm sorry, I should have asked at the outset. You made a couple references to it for life. Is that as advertised?
Oh, no, that's
So if I sign up for Ozempic tomorrow, the physician will tell me you got to take this forever.
Those are the instructions, yes. They admit that there's
Yes.
unknown medical
We expect that to be the case. I told you about that earlier. I did all the hands and everything.
problems. If you go up, but that's on the box. No, this is a lifetime injection. The key thing here, Tucker.
I know, and so I bring that up
depending on the
because
doctor.
some people are like, no, I don't want to be on this medicine for the rest of my life. Okay, but then it's also the conversation. If you're on this medicine for the rest of the life, but that means there's 4 other medications we can get you off of, that's a cost-benefit analysis, and I can't make that decision. That's joint decision-making between you and your doctor. And so that's between me and my patients. My job is to give them the options, tell them about it, and he's talking about it in the weight loss, but Ozempic itself is only indicated for type 2 diabetes. So
you're paying off the medical groups. 50% of TV news funding. I mean, I think
I've seen it.
Yeah, and there's RFK's talked about this back in the day with Roger Ailes. When 50% of your bills, speaking of the choir, but 50% of your bills are paid by a certain interest, why didn't the news media have any curiosity during COVID why people were dying of COVID. Metabolically healthy people weren't dying of COVID. This is where the corruption and really where it all ties together.
I'm sorry, will you describe that in a little more detail?
We had probably the biggest event in American history since World War II, where we shut down the country, where we really, I think, showed our weakness just physically and mentally as Americans. You know, American COVID deaths were substantially higher than other countries. And research, it's not argued.
Talks about the health of your population, your region. The United States is a very large landmass, and state to state, you see cultural differences. Even when it comes to weight, you can look at graphs and say, oh, we've got higher rates of obesity here and here. And I live in one of the regions where there are higher rates.
Has come out
and then that's
saying that COVID was a foodborne illness. Dying of COVID
and your
was a foodborne illness. If you were
comorbidities
stable cholesterol, stable fasting glucose,
I agree.
You didn't die of COVID. COVID
For the most
disproportionately,
part.
overwhelmingly, even among older people, affected people with comorbidities. And we're a lot sicker in America.
And the comorbidities were caused by eating bad food.
Comorbidities are obesity, heart disease, diabetes. Those are the main comorbidities. So if you did not have those, you were essentially not impacted by COVID and had almost 0% chance of dying.
Not all the cases, but I mean, a whole lot. I'd say a whole lot.
Media, though, right, who's heavily funded by pharmaceutical companies, didn't have any curiosity about that. Didn't have any curiosity. Maybe this is a 9/11 moment that we're not at our best as America, right? We are a sick, depressed, infertile population. Sperm count is down 50%.
I have
25% of.
I talk about this a lot today at work too. So especially men, they come in and they're like, I want to get, what are my testosterone levels? I'm like, well, why do you want your testosterone levels checked? I'm like, oh, well, I'm tired. I'm like, oh, okay, well, there's lots of things that contribute to that. And oftentimes we're overweight. We're at risk of sleep apnea. And I'm like, well, let me check out the back of your throat. I'm like, oh, it's crowded back there. What do you think about getting a sleep study done? As well, I like to do my Epworth sleepiness scale too. We check a few other things. And our adipocytes, so our fat cells, have an enzyme in them. And they change some hormone levels around. And that in and of itself also decreases testosterone levels. And fellas are always a little shocked, but sometimes they're like, well, you know, let me see how I do with some lifestyle changes and some weight loss and see if we can't make a difference there.
Women now have PCOS.
Oh, yeah.
We are having trouble reproducing as a species. And
so with the PCOS, and it's the same thing within the women. We've got more adipocytes, and with those adipocytes, we're changing hormone levels around. You could almost think about it as being on a really bad birth control that was not having the same amount of hormone levels and not the same amount of hormone levels. And so our regular estrogen and progesterone, instead of being, we come up throughout the menstrual cycle and we come down and everything's got its own curve, they're kind of all over the place. Like if you were taking a birth control pill, but you only took it some of the time, you're going to be moody, you might have some bleeding, our periods are going to be all over the place, it's out of whack. That's kind of, our understanding about PCOS a little bit, if that helps and makes sense. So, but yes, lots of infertility, and it also is weight related. So I have a lot of patients where, they're looking towards getting pregnant, and I'm like, well, we know that you will be safer in pregnancy, baby will be safer, baby will be healthier in the long term if we're able to have some weight reduction. And someone can be in class 1 obesity or overweight and be much healthier than someone who has a normal body weight if they are eating well and they are exercising. So it's not just looking at the scale to get our indication for this.
To talk about this, but instead the media, the government institutions who are paid by pharma, pushed a pharmaceutical solution with trillions of dollars of airtime as the solution to our crisis. This was one of the greatest public policy mistakes in American history. What, after coming off of the worst public policy failure, I
just
one
wish
of the worst
that the
in American
news
history.
wasn't interfering so much and politics interfering so much. I wish COVID itself could have been a conversation between the patient and their doctor. Let us deal with it and leave everything else alone. The news made a mess of it.
On every level, keeping the bars open and shutting down the schools.
That's silly.
To pushing an effective pharmaceutical solution instead of root cause solutions. We're being asked to trust pharma when 80% of the American people, their bodies are like rebelling against them with obesity, which are clearly a sign of underlying issues, where Ozempic and daily, weekly shots is not the root cause.
No, it's not
this
the
just
root
on its
cause.
face doesn't make sense. And then you trace the corruptions. Again, Ozempic is paying off everyone. They are one of the 5 largest funders. The company itself, one of the 5 largest funders of news ads. One of the
I don't
top research
have
funders of obesity
cable,
research.
if that helps, so I don't watch the news. My patients do, though. I always like the Puffs Puff with lotion. Those are the cutest commercials ever. I will look them up on YouTube. I think they're so cute. Like back when I did have cable, when I lived at my parents'. I'm too cheap.
Just wonders to university on the obesity topic. And the thing I, kind of ram home here, Tucker, is you just have to look where the money is. So if you actually look at the analyst reports that are propping up these stocks, they're assuming an increase in obesity.
Oh yeah, we're expecting rates to rise.
Company in Europe, they literally, where the money hits the road, where people are investing billions of dollars, they're assuming increased rates of obesity over the next 10 years.
I hope that's not the case.
I was talking to a doctor at Harvard. They're underwriting a loan for a new obesity center where they can treat and issue Ozempic. Those loans have projections for growth of obesity. They're not projecting that increased Ozempic is going to decrease obesity. The loans that are underpinning these medical centers, if you go to any city in the country, the biggest, most beautiful building is some kind of new pediatric, obesity center or cardiology center. The loans assume increased rates of conditions. So fundamentally, we have the largest industry in the country, healthcare. Not asking, imagine the leader saying, how do we reverse obesity? How do we cure obesity? They're not asking.
Well, I sure hope someone is asking. I sure get on my patient's case every day. You can lead a horse to water. I am not at home to be a boot camp leader. No. On my YouTube channel, I try to encourage. I have coordinated handouts and videos. I'm just one person. I can only do so much. I'm not in politics. I might try and convince my husband to do it, though. We'll see. He's still in school.
Obesity is not your fault. Oprah, who's involved with Weight Watchers, just apologized for preaching personal accountability over the past decades. She said it's not personal accountability. We're supporting
That's depressing. There should always be a sense of personal accountability. You don't eat. If you don't work, you don't eat. If you're going to eat poorly and not exercise, there are consequences for that. That is personal accountability. And like I've been saying, these medications are tools to help you. They're not going to do the work in and of themselves. But that is kind of depressing.
Obesity is becoming something.
But that's
she's highly involved with Weight Watchers.
But that's the societal shift.
Yeah, Weight Watchers has shifted from a personal accountability
People don't want personal accountability.
Teaching for decades and is now a prescriber of Ozempic. They've totally changed because Ozempic is a better business model because you never go off it.
This is insane. So maybe one of the reasons this is
I suppose from a business
accepted.
standpoint, yes. But there's a lot of other medications that people don't go off. If someone has type 2 diabetes, they should be on a statin. And why? It's not because I care about your cholesterol. I care about your cholesterol, but I care about your risk of heart attack and stroke. And often when I tell my patients, hey, your cholesterol is high, I've taken a look at your blood pressure and your cholesterol, and I've calculated your risk, it's your ASCVD risk, and your risk of heart attack and stroke in the next 10 years is 23%. Then we should be on a medicine to reduce that risk. I consider that long term. We usually stop when folks are about 80, but it depends. What are the risk factors? Are we tolerating the medication? Okay. And why would I stop at 80? It's, well, how much longer am I expecting you to live? If your risk of heart attack or stroke in the next 10 years, but we don't care if you have a heart attack or stroke in the next 10 years, well, then just come off the medicine. Is that rough? Maybe, but that's the reality. And a lot of these medications, same thing with blood pressure. My little frail little ladies, we want our blood pressure controlled. Okay, well, why do we do that? We think, heart health, again, a lot of that heart attack, stroke kind of risk. But if you're more risk of falling, being dizzy, lightheaded, I would rather your blood pressure run a little high so that you're not going to get dizzy, lightheaded, fall, and break a hip. And then you break a hip, and then you're in rehab, and you go downhill really quickly. So there's a lot of medications in general that we consider to be long-term. This is just one of them. Even for type 2 diabetes, we consider any medication to be long-term. So I don't know why he's getting hung up on that. Maybe it's because I'm biased, but I have people on long-term medications all the time.
People don't see it as totally crazy as I do. I don't take Advil, so
I like me some Advil.
Like the average, say, 65-year-old
So
person.
NSAIDs, that's a group of medications. Advil, ibuprofen, naproxen, Aleve, diclofenac sodium. All of those people are like, I'm scared about my kidneys and hurting them. If your kidneys are fine, if you take them for a week, ladies, if you've got menstrual pain, oh my gosh, please don't be miserable. Just take that. I would rather do the Aleve or the naproxen because it lasts for 12 hours. I know, I'm getting on a tangent. Do it 2 times a day. you're not at risk of taking too much, whereas with the Advil, because it only lasts 6 to 8 hours, or your Motrin, 6 to 8 hours, people tend to take more of that than they need. But if you do that for a week, your kidneys are going to be fine, everybody. Oh my gosh, please don't be miserable and in agony. I feel you. Those cramps are awful. Okay.
In this country is on how many drugs?
Yeah, about 7.
7. And not just intermittently, but like...
And quite frankly, a lot of that is lifestyle related. If we could exercise, if we could eat well. And then I ask people, how many times a month are you eating out? And I have to clarify, how many times a week? Oh, I'm still eating out 2 times a week. If you would just cook your own food at home, you would probably be just fine and not need all these medicines. I'm all about the lifestyle changes.
90+% of funding for medicine dollars is around chronic lifetime.
So
It's more recurring revenue.
So describe what that looks like the scale of it.
Yeah, I think again, we're so
I
desensitized
also
to
want to bring up
crazy.
a
Yes,
lot of
Angela.
insurance. They don't want to pay for these medicines because it's like $1,000 a month. They don't want to pay that. It is much cheaper. This is how I process it in my mind. If we could have you on some metformin and, some lisinopril and some atorvastatin, and these are on like the $4 list at Walmart, I can have you on these medications. It's going to be a whole lot cheaper per year. Yeah, you might end up in the hospital maybe every 3 to 5 years, and that might be an $18,000 bill, but that's still going to be cheaper than paying $1,000 for this medicine. But overall, you wouldn't need a whole lot of the other medicines, and your health would actually be better. And you would probably be able to do more activities that you want to do and have a better quality of life being on this medicine than if you were not, had the weight, needed all those medicines, and ended up in the hospital. And so insurance companies are doing this cost-benefit analysis. So that's how I process it in my mind. Is that true? I'm not sure, but that's how I see it.
You would spend. Well, I'll give you an example of my mom. So my mom was 71 and went, for a checkup and was told by the doctor she was healthy. And she was actually at the time on 7 lifetime medications. So she was on, maybe a decade before, had high cholesterol, was prescribed a statin. And the message from the doctor was, no problem, most, the majority
We
of all
needed
people
a
your age are
whole
on a
pot
statin.
for
No problem,
this.
that's a rite of passage. Then she had high fasting glucose. Again, that's basically prediabetes, which majority of people have. Metformin, one of the most prescribed drugs in the country, high blood pressure. So she has these comorbidities that are almost seen as like rites of passage. It's a rite of passage for a
Rite
man
of
over 40
passage.
to be
Now, people get freaked out when I talk about chronic kidney disease and, our kidneys are just, not doing quite as well. I mean, the kidneys do tend to go downhill a little bit. That being said, if we are active, if we are eating well, we probably don't need most of these medications. Was his mom doing all these things? I don't know. She's not my patient. I don't know about rite of passage, but I got one patient. He's in his 80s. Best shape I've ever seen. I asked him, what do you do? And he's got a little mini rebounder. He's got his 2-pound weights. He watches TV, goes on his little mini trampoline with those weights. Awesome shape. And he's on no medication. He's got a little GI stuff going on, but still awesome shape. So no, if you do the right things, you don't need them. It's true. But how many people are willing to do it? And the idea of personal accountability, but I think that's a societal issue.
The majority are. So these were all kind of normal things. So as we treated everything in silos, that's a lie. Heart disease, diabetes, in many ways depression, Alzheimer's, they're branches of the same tree.
Well, now when it
actually
comes to
lied.
the dementia and the Alzheimer's, I mean, if we're moving our body, if we're moving our mind, keeping our mind active, those are good things to help with prevention, making sure we're getting enough sleep. If people have untreated sleep apnea, they're going to be at higher risk of early onset dementia. So in some ways, yes, it's still a little bit related, but not always for that one. The rest of the stuff, lifestyle related. I'm in agreement there for the most part.
For different conditions, seeing 4 different doctors for 4 different treatments, they don't even talk to each other. So we're managing the symptoms.
Now that's a primary care issue, not talking to each other. Well, I mean, that's an issue. I don't know where this guy lives, but that's not good. I want to get my hospital system uses a electronic medical record called Epic. I like it. A lot of my specialists, they also use that system and everything gets uploaded and I'm able to see their notes very easily. But for my specialists that are not in network or they're seeing someone outside, I always get my release of records and get my patient to sign the form so that I can get those records, because I want to know what the other doctor is doing so that I can stay on top of it. That's what we do in primary care. So can I call BS on that? So if his doctor is not being in touch with specialists, or maybe he went to the doctor with his mom and his mom's doctor was not doing all that, well, that is not how I do things. Thank you very much. And that is maybe crappy care. So I'm so sorry, Mr. whatever your name is. It started with a C. But that is crappy care. I mean, it just is. Ooh, I should know what's going on with my patient. I want to know. I want to know what other people are doing.
We have a root cause metabolic crisis. That's why the more statins we prescribe, the more heart disease goes up. The more metformin we prescribe, the more diabetes goes up. The more SSRIs we prescribe, which are now 25% of women.
The higher the suicide rate goes.
We're seeing skyrocket. So we're siloing everything. And literally,
there's so many questions.
Yeah.
So 25% of women are on SSRIs?
We have a societal dynamic where 25% of women in the United States are on a medication. And I'm not just flatly anti-drug, but this is a societal dynamic, Tucker. We have 25% of women taking something fundamentally.
I don't know if it necessarily numbs you out from reality. And if it does, that's not good. That was not a good pick for you if you are so numbed out. I've got a video where I talk about some brain health. I'm going to link that so I don't keep talking about it. But there are actual brain chemistry changes and things that go on in the brain when it comes to why we might want to consider medication for a season. Maybe it's short term, maybe it's long term. And I'm telling you, a lot of women go through some really horrific trauma. Sometimes there's not a lot of trauma, sometimes there is. And sometimes we need a little help. And I think a little help is okay. Sometimes we want to use medicine, sometimes we want to use counseling, sometimes we want to use a combination. Sometimes we want to throw everything at it. So we want to use exercise. Exercise 1.5 times better than medication. But what do we do when we're exercising? Things are not getting better. We might try some medicine, we'll try some counseling. We want to do all the above. And we might do that for a season. We'll learn some good coping skills and we can come off the medication when appropriate. But if someone's going to go and we need some kind of safety plan. I'm going to see you real regularly. I got you folks. I'll use my sick visits for you and get you in.
And we don't even blink an eye at that. And depression, mental health disorders, anxiety, suicide. Suicide is now the second thing causes death for young adults.
It's sad. It's true. It's sad.
Yeah, and which I think could be related. And SSRIs, you talk to any high schooler now and looking in it, it's the first line of defense. I mean, it is prescribed like candy when
to children?
For children.
SSRIs.
No, SSRIs should not be the first line of defense. Counseling, home situation, fixing that should be our first line of defense. So, this guy's not a doctor, so what do I expect? But it should not be the first line of defense.
SSRI prescription rates are skyrocketing among teens.
Yeah.
You talk to any high school counselor.
Oh my gosh, after COVID, this is
never talked to a high school
awful.
counselor.
Yeah, well, that's very smart.
Mood
they're
is
skyrocketing among kids, and there's actually a black box warning on SSRI's label actually saying that
especially when we first start.
And they're widely prescribed to children. Not to mention the fact
now,
that
do we know why exactly? One of the reasons might be that it peps you up a little bit in terms of feeling better, but your emotions haven't caught up. So you have enough energy now, but your emotions haven't caught up. So you're able to act on all your dismal feelings. That tends to go away after we're on it for a few weeks. But yes, that is there. We do have that black box warning.
Are on essentially methamphetamines, Adderall, which if you read the book Blitzed, actually traces the history. Adderall was developed by Nazi Germany as a tool for Nazi soldiers to be more aggressive. And
we also use it to keep our kids in trouble, and so out of trouble, rather. And when it comes to socialization, if your kid is struggling so much that they cannot make friends because they're all over the place and no one likes them, our goal is not to have folks on stimulants like that with our Adderall long term, because we don't have great data about that kind of in the long term. A few folks are. Our goal is to do some counseling, get some coping skills. You need a lot of regimen kind of in your life, very highly scheduled. Electronic use is one of the worst things that you could use if you are a kid with ADHD, if you are an adult with ADHD. Put down the darn phone and the video games. That is the worst thing you could be doing. Destroys your attention span. We got to get rid of it. We got to get rid of it. All right. I have a video on ADHD too. Check that one out.
Along with SSRIs to kids.
One thing I'm trying to keep track of everything you're saying, all of which is checkable, I assume, on the internet. Statin drugs are prescribed to the majority of American men over 40?
The last rate, I think 2019, the last study I said was 45%, and I think there's reports that now post-COVID it's close to 50%.
But then I ask you what you're having for breakfast, and you tell me, I have biscuits and gravy every day for breakfast. I am not in the kitchen to cook for you. There is only so much I can do. Put down the biscuits and gravy.
So what's the downside of statin drugs?
Oh, there's wild research coming out.
We've used statin drugs for years.
They'll have no side effects. Heart disease isn't a statin deficiency. What statins, to me, at the most important level, represent...
I already told you about our risk of heart attack and
Fundamentally,
stroke.
when you're prescribed that statin, you're told by the doctor that you're doing something. When you're prescribed the Ozempic, the doctor, Fatima Stanford on 60 Minutes, who's a paid-off doctor from Ozempic, said, throw willpower.
No, you need willpower.
Food isn't the problem. It's a medical issue.
This is where I'm like salty and did not want to watch the whole thing.
So you have these messages.
Because this is kind of BS-y.
You're doing something.
Can I say that on
YouTube? What you want to eat. You wouldn't even believe this, but until 2018, and Dr. Robert Lustig, who's a hero of mine, has pointed this out.
Because you do need some self-control.
The American Diabetes Association said that as long as you take your medications, you do
now
not...
that is depressing.
So
No, what I tell my patients is that exercise is the only time that your body can scoop up sugar directly out of the bloodstream. Your muscle cells are able to do this when you are huffing and puffing in exercise. A lackadaisical walk will not do it. Every other time, every cell, including muscle cells, require insulin. This is what doctors like exercise so much in every condition, but in particular when it comes to diabetes. As well, I've got another little video I will link here about there were some studies where if you have a bit of protein or a little bit of fat before your main meal, we can keep the overall sugar levels decreased. So I'll link those below, everybody. Yes, you have to put the work in. We can make diabetes better with diet and exercise.
From the American Heart Association, from the American Diabetes Association, now from the Obesity...
Every doctor should do that. I hope.
If you take these drugs...
But they're tired. They're seeing too many patients. They're not sitting it down and talking with you.
For a chronic condition that has lowered the rate of that chronic condition.
What's the cost of all that? Just diabetes?
Well, with diabetes, this is the root cause.
I feel like insulin is expensive, though.
Almost
That's
100%
expensive.
people with Alzheimer's have prediabetes or diabetes. Diabetes is one of the... Seriously? Alzheimer's is now called type 3 diabetes. The most highest indicator you can have for dementia or Alzheimer's is some kind of blood sugar dysregulation. If you have normal fasting glucose levels, your chance of having any type of dementia is very, very low. Dementia is highly tied. Again, I don't even like using the word diabetes. Our cells, diabetes is cellular dysregulation caused by our environment or food. Again, the majority of people in this
I suppose to an extent you can say that, but there's a couple things going on. One, the pancreas is getting tired of squirting out the insulin. We've got some resistance in the cells to the insulin. And when we think about weight in particular, is it the chicken or the egg? We don't know which one comes first. And there's lots of studies trying to figure that out. And we don't know. Is it the weight that causes the insulin resistance? Is it the insulin resistance that causes the diabetes? We don't really know.
we have some form of that happening inside their bodies because our environment, this is unprecedented. So diabetes is really the root cause. But if you just take diabetes, this is one of the biggest line items in the U.S. budget. We're spending, if you add up all the line items we're spending on healthcare just to manage diabetes, it's more than the defense budget.
The U.S. government spends more managing diabetes.
If they want to spend less money on diabetes, then in the school systems, they should be putting more money into healthy foods, more education, more exercise. I ask my kids, hey, because I'm a primary care, I see folks from, I'm not delivering babies anymore. I'm sorry. I enjoy sleeping in my own bed. Yeah, I'm just saying that. Wonderful to deliver babies, but I'm not doing that. But I ask my kids in elementary school. So yes, I see newborns all the way to we're on hospice getting ready to go meet our maker. And I ask my kids, are you getting an hour of exercise every day? No, they are not. And they might be getting a couple hours in the week with school, but that is not what they need. They need an hour at least every single day. And that is a parental responsibility. And I do think kids can be educated on that, but also the parents need to be educated on that, which I do. And I pester. And then they don't want to come see me because I said they're not supposed to be on their phone. And I make them show me your screen time. How many hours are you on your phone? Mom and Dad, are you checking this out? Are we checking how much screen time every week are we checking in? And are we getting in the chats and going into all the apps? Do we know what's going on? The phones are not private. The diary under your bed is private. But those phones, they are not safe. They are a time sink. They are making us chunkers.
If you want to stack rank what would bring down the American Republic, it's not, marginal rates of military spending. It's not, what the marginal tax rate is. Our biggest line item in our budget, the biggest part of our economy is healthcare, and it's also the fastest growing industry. Healthcare is the largest and the fastest growing industry in the United States. The bulk of that spending
you got to move your body.
And as it grows, it produces worse results. It is not slowing down. It's going to be
I don't know how to make that
in about 15
change.
years.
I have interactions with patients one day at a time, one encounter at a time.
Sicker population at an almost
but I can only do so much.
We're going to cease to exist as a country because we let
I'm not going home with you to
you
see if you went on the treadmill or went for a walk around the house or went up and down the stairs a few times.
It is healthcare costs. It is metabolic dysfunction.
And is diabetes the biggest?
Diabetes and prediabetes is the root of almost everything. You have very few people with heart disease, with many forms of cancer, with dementia, with all these. This is the lie that's being told. When my sister graduated Stanford Medical School, she had to choose between 42 specialties. She was a head and neck surgeon, and then the fellowship was going to be even the smaller part of the body, 1 millimeter of the. That's what doctors.
That's why I'm in primary care. I like everything.
That's a lie.
That's why we go to family medicine.
Right? She looked at a patient's report. They had 60 pages. They had prediabetes. They had depression. They had heart issues. She didn't speak to those doctors. And she was never trained how the inflammation that she's cutting someone's face open and taking out, not once at Stanford Med School was she trained or even brought up why that person has inflammation.
That's depressing. Stanford, if there's supposed to be some kind of bougie medical school, that's not where I went. I didn't go to something real bougie like that. And I'm on a budget, y'all. And that's that's depressing. And that being said, her basic science education would have been a long time ago. And so the way it works in medical school, in the United States and Canada, some other countries will do it like this. A lot of countries, you go straight out of high school and go into medical school for like 8 years. But in the United States and Canada, they like us well-rounded and will usually do a 4-year undergraduate degree. For the most part, at least that's for what you need for requirements. You can technically complete everything in 3 years and go directly into medical school from there. I would say most people don't do that, or maybe they do something else, and then they do their 4-year degree, they go to medical school. Medical school will consist of 2 years of basic sciences, another 2 years of kind of in-hospital and clinic training, and then after that you do residency. And residency, depending on what you do, is another number of years. For family medicine, I trained in the United States. Family medicine residency is 3 years, whereas in Canada it is 2 years. Internal medicine is, I guess, they do 3 years too. But if you want to do a cardiology or urology or rheumatology, whatever it might be, then you do another fellowship on top of that. For surgery, basic residency to be a general surgeon is going to be 5 years. And then if you want to do specialty, it sounds like some kind of ENT, they're going to do some more specialty training. They might do the first year or two in general surgery, and then from there move on to a more specialized ear, nose, and throat kind of surgeons. I do think that the ENTs, because they're all up here and they spend most of their time here, make the best, plastic surgeons. I'm just going to say the nose jobs are very nice, which is a little on the cosmetic side. Whereas your general surgeon that went into plastic surgery, they did surgery everywhere and not as much, which is very much so an aside. I'm not sure I brought that up, but because they are more specialized for this region, they do more fine detail. I would say that in general. I don't refer to plastic surgery a whole lot. Like trauma stuff with burns and everything, I'll do that. I really don't. But that is very depressing that his sister, the doctor, cannot remember from her basic sciences. Or maybe it was too long ago and they didn't have great data to share. But he's speaking very poorly about his sister's medical education. That's depressing. But most specialists, they just want to be, they want to know, what does primary care do? And I would say it is primary care's job to manage kind of all the specialties, make sure everyone's on the same page. We will do group chats. So like I've got one patient, and we had who did we have? We had GI, myself, we had psychiatry, and we were working on management for this patient, and we were able to be in touch with one another. And I think that's really nice. I love it when we get to do that. I love that psychiatrist. He's such a good team player. Does great communication.
In the first place, that surgery, Medicaid will pay $20,000 for that, along with all the other comorbidities the patient has. We're training doctors, right? Medical schools, pharma companies, hospitals, doctors, nurses, insurance companies. They make money when people are sicker for long periods of time.
I got enough patients. There is a doctor shortage everywhere. If I could have healthy patients and see you not but once a year, I would probably like that a whole lot better, because there's a whole list of folks that need a doctor and wait lists, and would rather do that. Can I call BS on this guy again? I'm getting salty again.
It's the silo conditions. That's why Ozempic is so important, because obesity is not a siloed condition. Obesity is a visible example that we are losing our way as Americans, and treating that in a silo is just medically not going to work, and it's happening because of corruption.
So, but it is, and I should just say I agree with everything. Yeah. But even if I disagreed, it doesn't matter. I would say Ozempic is a response to an actual problem. You conceded that. So if Ozempic isn't the answer, what is?
If you were an alien that came down to Earth and saw what's happening in America, and I want to make this clear, it's happening specifically in America. I mean, our obesity rate, diabetes rate, heart disease rate, it's multiples more than some European countries and Japan, countries like that. There's something unique happening.
Yeah, and if you take someone, for example, from Japan and put them over here, they're going to be getting a little bit plump. The food is different. I don't even know how to begin to change the food. Besides, tell people, cook at home. If you cook at home, you'll be fine.
Came down, an alien that was smart, that kind of, had a veil of ignorance and looked around, and you saw 80% of Americans consuming such toxic things in their environment that their body.
I'm telling you. I was talking about those Skittles.
Dysregulation. Obesity is literally the cells crying out for help and showing that they're dysregulated, which represents stuff happening visibly in the body, such as all the chronic conditions we've talked about. If you look at that happening, highly related to mental health disorders, highly related to infertility, all connected, you would never say, let's keep everyone sick and give them marginal drugs. You would just never do that. We have been completely gaslighted by pharma. Elon, who I
like how everyone just calls him by his first name. Oh yeah, Elon.
Are good. I think it's a little bit unlike
first name basis.
We're not analyzing the problem and assessing what the root cause solution is. I think we've changed our reality. We've changed our perception of kind of what reality is based on pharma.
I hope we're not changing our reality based on pharma.
We lost our way, right? The drug for every condition in a silent state hasn't worked. We're all getting sicker. We've totally lost our way. Peter Thiel pointed out that if you control for infectious diseases, and acute things that would kill you right away, life expectancy really hasn't grown in the past 100 years. The almost 100% of life expectancy increase, which we all herald, is acute issues, things that would have killed you right away, childhood mortality. If you actually chronic
polio, appendicitis, stuff.
all that stuff. Yeah. And so we actually really lost our way. And if there's one moment to kind of, as a country, say, can we change course a little bit?
Yeah.
It's this.
We need to move, and we need to eat more vegetables.
In America, when drugs are prescribed widely, costs don't go down. You're not allowed to lower drug prices if they're prescribed widely. And the moment Ozempic is approved, which is an all-out battle to do for government funding,
I bet it'll happen.
There's an incentive for every obesity doctor in the country to prescribe this. 80% of American adults and 50% of U.S. teens. The government then can't tell the doctor what to prescribe.
Technically,
so you've got a $20,000.
I mean, this is splitting hairs, but the brand name Ozempic is not actually indicated for obesity. I do feel like that is an important point to make. Now, the exact same medicine has another sticker on it and just a different injection pen called Wegovy, and that one is. But I mean, it's the principle of the point. But technically, that's not actually what's indicated for weight loss. So,
Matt, 50 million. We have much more than 50 million obese people. 50 million is well over $1 trillion a year. This is why the stocks are going up, right? So the battle here, and this is my point to Elon and a lot of people, I want you to understand the battle is what are we going to do societally about the metabolic health crisis?
And what should we do? Like, you're in charge. I know you said you're a libertarian, but let's just imagine you were a fascist.
Who was that? There was a chef that I really liked, Jamie Oliver, and he's from the UK. And he was changing the school food, like the lunches at school. I remember seeing him on TV or something like that. And he went in and was revamping the lunches on a budget and eating healthy. I don't think he's as popular in the States. I asked like my friends and my mother-in-law, she's never really heard of Jamie Oliver. I think it's a Canadian thing. I think he's great. I love his like the 5-ingredient cookbook. Because I mean, I can pull 5 things out of the fridge. I could do that. So could you. I'll link that book down below too. I'm sure I can find it on Amazon.
It's not what I think the president can do numerous things tomorrow that will dramatic. I think one of the biggest lies we're being told is this can't be turned around quickly. We did not have a metabolic health crisis a generation ago. We can turn this around very quick. I don't think the American people are.
So basically, we have to change how we're eating, change the food we're giving our kids, prepare that for the next generation.
No longer be the only country in the world that allows
exercise needs to be cool.
Which isn't to influence the consumers; it's to influence the news. Pharma buys off the news, and the FDA can issue an order tomorrow saying that that's no longer the case. That we can't have pharma spending on TV news. That is an executive decision. It can be issued tomorrow, and it would totally undercut the ability of the pharmaceutical industry to control our information. Food stamps, the ag bill.
I do think when it comes to the food stamps, and they were talking about all of that, paying for pot, soda pop,
TV spots,
that's not cool.
Not to convince people to ask for specific drugs from their physicians, but to subvert the news business.
My patients ask me for medications all the time. I'm like, that is not the best medicine for you.
Silly ads
we got some other options. Let's go through some of those first. And then we might consider.
They've already bought off the doctors.
Sometimes it is indicated.
This is an open secret.
It depends on what they bring up.
Ad spending from pharma is a public relation lobbying tactic, essentially to buy off the news. The news is a referee. They're not.
I feel like the drug advertisements on TV, though.
The news has become basically a referee.
They're more just like a pain in the neck.
Anti-science Luddite for asking why.
Because then I have to do like an education spiel, and it's true. I mean, it's lovely to educate patients, but it's also a time issue.
Why it's gone from 20 to
I
70.
just kind of want to take care of their issue. Hopefully do the best thing for them, give them some different options, and then move on.
GlaxoSmithKline and Merck, in the past 5 years, has settled 2 of the largest criminal penalties in American corporate history for bribing doctors and misleading.
I mean, that's depressing.
We're the 2 largest vaccine makers. So you literally have the media playing referee that you can't even ask a question. Parent is actually.
If you have a vaccine injury, and many people have, including some I know very well, even a profound vaccine injury, you're not allowed to complain about it.
No, you're anti-science.
Even
I have a published paper on like crazy vaccine stuff.
So in all levels, right?
I will link that too.
And I'm not very dark, Callie.
I'm the second name on the list.
Empowering. I think this is why we have an opportunity here, Tucker. Like Ozempic, this is not.
So I'm not the first name.
It's kind of this funny thing. Like it's kind of vain. I can lose weight.
But I can link that too.
The reason the stocks are going up is because this is going to be a lot of money.
I want to see both sides.
The highest funded drug from the U.S. taxpayer in history. We've got a society. When are we going to say, let's go another direction? Why are we trusting pharma now when they've been completely acting to garner no trust? We have to be basic here and incentivize better eating, better farming. Think about public policy, and healthcare. How can Americans be more active?
We can lead by example. I planted so many raspberries. You should see all my seedlings. I got squash, cucumber going.
University researchers.
I even got some corn growing. My little seedlings are doing great.
Yeah,
you can too.
The president can say, we're not going to touch NIH funding, but we're not going to issue grants anymore.
And I have a hydroponic system, and I grow half of it is kale, which keeps me from going to the grocery store regularly, so that I can have something green and a vegetable.
And NIH funding.
Exactly. So you could do that. You could change ag subsidies.
And you can have that in an apartment, which is what I did, even though I live in a house now.
Restrictions on university
which is why I'm planting all my
R&D labs for
seedlings.
pharma. And I think a key one.
So you can plant something in a pot.
This isn't just some industry group. The American Academy of Pediatrics, the American Diabetes Association, these medical groups have statutory authority to create the standard of care for how we practice medicine in the United States. They are funded majority by pharma. So the groups that are literally have statutory power to create the standard of care for diabetes.
Doctors have some
why aren't doctors
critical thinking power. And from what he said about his sister, she might be very skilled, talented. I don't want to be bashing on some other doctor, but I'm telling you, if she's telling him, I don't know anything about this, something is going on. Doctors, we should have critical thinking. We are trained to be critical thinkers and say, hey, is this a good fit? Is this the right medication? Guidelines change. We're supposed to be checking updates. We need to be constant learners. One of my favorite cardiologists, he gets to work early. Yes, he goes through his different procedural type things that he does for his patients. And he reviews the most up-to-date information on a regular basis every single morning. I know because I trained with him, and I thought he was wonderful example of what long-term learning in a physician looks like. And doctors should be doing that, which is why I like the YouTube, because it forces me to learn, and I have to go check the latest guidelines so that I can make sure that I'm bringing the latest guidelines to the internets and keep the internet trolls off my back. Nobody liked when I talked about weed. I broke it up into little shorts. Oh my gosh. I'll put that video down below too. Watch the whole thing.
Giving their patients prescriptions for food interventions if they have diabetes. Why aren't they giving them and prescribing them and allowing them to use their medically tax advantage dollars to exercise? If you actually
when it comes to exercise, so there's some insurance plans where you have a pot of money that you can pull from. I'm sorry, I can't think of the name right now. I wrote a script for a bike for one of my patients because you can do it for like those Peloton, like stationary bikes. And he wanted like a dirt bike or a road bike. I'm like, let's give it a try. I don't mind. You need to exercise. This is your preferred form of exercise. Insurance paid for his dirt bike. Y'all, if you've got that kind of pot of money thing, if you do, you know what I'm talking about. And if you're in the States anyways, and ask your doctor. They paid for it. He also just he broke his foot doing something else, the poor guy. But we're biking now. We're in great spirits. And he's got his dirt bike to ride on. Just make sure you wear a helmet if you're on your bike. Wear the helmet. So yeah, we want to exercise.
But we're so gaslighted by this. It's just not even batting an eye that it's just pill. Americans follow incentives. It's what we're trying to do is you can actually,
blood pressure is getting better, if you are exercising, if you are eating well, if you're consuming less salt. Yeah, I love being able to say, hey, let's decrease this dose of medicine. Let's see if we can't come off. You're doing great. Man, you are down 10 pounds. Give me a high five. Keep it up. We're going to check again in a month. Or I'll have my nurse call and see how your blood pressure has been over the month with the half dose. But if we can come off, gosh, we want to come off. I would hope most doctors want to do that. We don't want you to be on a bunch of medicine. We want you to be healthy. We want you to be living your best life. We do not want to see you all the time. We love you. Would rather see you at the grocery store and might slyly notice that, hey, look, you got more vegetables in your cart than I do. Though I do realize the cost of groceries has gone up. So plant some seeds. It's the right time. It's the spring. Well, it depends on where you live. But after Easter, those suckers are going in the ground. I already got the asparagus in.
A note for exercise and food. And that actually can open up medical tax advantage dollars and other insurance dollars. Doctors could do that. But the second you get someone off the chronic disease treadmill, that's not a profitable patient.
Yeah, but there's so many people that need a doctor and cannot get in.
A kid with prediabetes,
that is not the issue.
They have hypertension, they have heart issues. They're going to be like my mom much earlier.
I call BS on him again.
Drugs, but you're not curing anything. These are conditions you need to manage for life. So we're getting people. There's a war to get kids on that bandwagon. We need to have the more clarity, frankly.
I want my kids to get the weight down so that they can have happy, healthy pregnancies, so they can be active and do what they want to do.
At the end of the day, which is destroying and profiting off.
And for them, it will likely not be a long-term medication if we're doing one of those GLP-1s.
And frankly, President Trump has made some strong statements about this. I'd say watching the GOP debate, it's like watching a bizarre world. Rome is burning in a lot of ways. We have a corruption problem, and it sounds like they're at some cocktail party in 1988, GOP cocktail party. It's not about the marginal tax rate. It's not about the Medicare Part D, page 300.
Think about all the tax money would save. Oh my gosh, if people were healthy. He was just talking about how much tax money goes towards healthcare.
People have come to the end of this conversation and want to learn more. I never do this, but I think it's worth it with you for sure. How can they learn more about your views on this? How can they learn more about these issues? What would you recommend?
Well, as we talked about, this is my life's passion with my sister, who was a doctor who left the system. And I'll announce it right now. I've helped her write a book.
I have not read this
just
book.
Put on Amazon today. Called
I don't know if I want to.
And unpacking these issues using her experience in medicine. We put our heart and soul into that.
I'm glad you put your heart and soul into it. I'm glad you worked hard.
In the country. And then my company is TrueMed.com, and we help write food prescriptions. It's our company, but I want to say that I think it's the most important issue in the world.
I briefly did check out his website. And so lots of those things that he talks about, I think are great. Those lifestyle changes, that's fabulous. Supplements, though, if you're eating a good diet, you probably don't need all those supplements. You are just making expensive urine. Most vitamins are going to be water soluble. My fat soluble vitamins, A, D, E, and K, you got to be a little more cautious with these ones. Because they are fat soluble, it's a little easier to overdose on them. Everything else, though, if you get too much, you're just going to pee it out. And like I said, you're making expensive urine. So if you're eating well, that being said, if you are a postmenopausal woman and we're worried about osteoporosis, calcium, vitamin D, I do like vitamin D supplementation. A lot of people after COVID were taking zinc long term. Oh man. Like this past week, like every day I had to tell at least 3 people, how long have you been on the zinc? Zinc is great in the short term if you have a cough or a cold, but it can decrease your copper stores, which can make you fatigued. Copper is important for a lot of chemical reactions in the body. Do not take the zinc long term. I don't recommend that when it comes to supplements in general.
To follow the science. Doctors need to, when somebody has a metabolic condition,
I like some fish oil too.
To practice better.
But if you could eat the fish 3 times a week.
When we were told The food pyramid.
Or flax works too.
We were told to stop smoking.
If you had a spoonful of flaxseed every day, then you wouldn't need a omega-3 supplement.
And our potential to say.
If you can get it from your food, I would much rather that.
Root causes in America and talk about food, talk about exercise, talk about sleep. You can transform your life. These policies would transform things. You can change your biomarkers in minutes. If you go on a functional medicine program and really have curiosity about what you're eating.
Change what you're eating.
What if we
that would be marvelous.
That message from our medical leaders? So we're working
if he's actually working on that, that sounds nice. But he's also selling supplements.
Kelly Means, thank you for that.
Thank you.
I'm not saying everyone who sells supplements is a shyster, and I think he has good intentions, but I do think that he has maybe some poor understanding of some medications and all that in general. So thank you for joining me today, our healthcare team. And if there's anything else that you're keen to learn about or want to know, or if you think there's something else I should watch and review, I hope you enjoyed that. I hope you, let's see, we still have Nutmeg. She's taking a nap. And I hope you enjoyed visiting with us. And if you want to learn some more, I've got those links down below. And we'll see you next time. All right, bye-bye.